All right, so what I was saying while I was muted was that I'm happy to be sharing with you today. We're going to just talk about things that may be helpful, but also prevention, because you and your family members uh, and caregivers, may be concerned about their own health, and we all want to age gracefully and as well as we can. So I'm just going to talk about these integrative, complementary, alternative, functional types of approaches that can be utilized. My only disclosure is that I have written this book, which came out recently. And yeah, I work at seeing patients at UCSD, so can see patients under insurance in many cases, although Medicare will or Medi-Cal will not pay naturopathic doctors yet. So hopefully that's coming. So what are naturopathic doctors? We are trained in the foundations of health. So we're really uh, preventionists. We want to try to prevent disease as well as boost our body's natural healing and kind of move up the intervention scale as needed. So starting with simple things like improving sleep, improving nutrition, and the means of building our health before we move into having to use pharmaceuticals, for instance, or go to surgical intervention. And so these are just the foundations. Like many doctors, we want to do no harm, but we want to use the healing power of nature as much as possible and to have a close relationship with our patients. And again, prevention. And we want to look at treating the underlying cause rather than just treating symptoms. And this is where treating the whole person comes in. Our interviews are very complex so that we understand everything that's going on in your body, not just a single system like many specialists do. So I wanted to talk first about what are modifiable risk factors for our health. So the common ones that we know are our cardiovascular risk, lifestyle factors like smoking and using alcohol, our metabolic risk, which can come to us through our genetics, but also our lifestyle, social isolation or loneliness, our nutrition, and our sleep quality. So these are all things that we can take some control of, and we can change these things to maximize our health. I was very surprised to learn when I first started back to school and took my very first chemistry class that we actually die a death, slow death, because of oxygen, among other things. But in the process of making energy in our body, or ATP, that is a natural process that generates what we call free radical. And so this is a free oxygen radical. It's usually designated by this little dot as an extra piece of energy that's just kind of hanging out there. And this extra piece of energy can do damage to our DNA, it can do damage to proteins in our body, lipids in our body. And then there are all of these other ways that we can get this damage over our lifetime. And this all contributes to oxidative damage and aging in general. And this is important in the aging of our brain as well. So the talk today is going to be outlined under these subheadings, which is the title of my book, Eat, Sleep, Relax, Protect, Forget, based on this whole system in our body that cannabis interacts with called the endocannabinoid system, which is considered to be a system to help ensure our survival. And so this is why it's an important one to talk about. And in this context, we will also talk about cannabis today. So this is just a funny joke of because more and more senior citizens are turning to using cannabis for different things. And this man is saying, I'm really feeling my joints today. And here's his partner who's actually puffing on a joint behind him saying, me too. And I would never suggest anybody smoke cannabis in this form. And we'll talk more about ways to use cannabis. So first I wanted to talk about the topic of eat, which includes nausea and vomiting, appetite, our metabolism, abdominal pain, how our GI system is functioning. This is particularly relevant for women who, compared to men, have many more digestive complaints and problems than men. And so we know that in this context, our endocannabinoid system is very well known to regulate our appetite and food intake. It's also regulating how we're managing making energy in our body, or our metabolism, our digestion, our motility of our gut, and inflammation. So this is an important topic with older people in general who may be ill or for any number of reasons experiencing a lack of appetite and therefore ending up with malnutrition. So it is possible to hack our endocannabinoid system using specifically the compound in cannabis known as THC, which is also the one that people seek for getting high. But we know that it stimulates what we call hedonic eating, or the desire for food, even maybe when we're not, maybe after we've already just finished a meal. Cannabis can provide what people call the munchies, or seeking after certain types of food. So this has been studied. This is a synthetic form of THC called Marinol, which is actually an approved drug. It was approved for weight loss in patients with HIV/AIDS many years ago, and also tested in people with cancer, showing that at this small dose of THC, it improved appetite and people ate more calories. This was repeated in a study in Israel of older people living in a retirement community where they offered their residents cannabis and they saw improvements in appetite. So rather than having to fight with people to eat, they were more willing to snack and accept food and eat more calories. So this can all be part of healthy lifestyle, which we're talking about these lifestyle modifications or modifiable risk factors. So one thing that we can modify is our metabolic risk by what we eat and by exercise. So I wanted to share a little bit about what this means in the context of Alzheimer's disease or even mild cognitive impairment, which is MCI on this graph. So in our brain is our biggest user of energy in our body. Even when we're just sitting here resting, our brain is using 25% of the energy that we're producing. And the brain really relies on glucose, one of the primary fuels for making our energy. So this is a scan where they use a form of glucose to see how the brain is using glucose, so that you can see here, just older people in general, here's the level of glucose use in their brain. Here's the level of glucose in people with mild cognitive impairment. And here's the level in people with Alzheimer's disease. So it's starting to look like that in Alzheimer's disease, this may actually be a bioenergetic problem in the brain. The brain is not able to use fuel. So again, here are these risk factors, modifiable risk factors: diet, exercise, our social activities, cognitive activities, never smoking or drinking or cutting back on those activities. And so again, this is now looking at people that were carriers of this protein called ApoE4, and this is thought to be a risk factor, right, for developing Alzheimer's disease. But if they looked at this estimated change in memory function over 10 years, and so we've got people who are favorably doing all of these modifiable risk factors. We have people who are not doing it much, and people who are really not optimizing how they're living. And so this change in memory was much worse in people that did not modify their risk factors compared to those who did. And then if you looked at people who were not carriers of ApoE4, you can see it was the exact same outcome. So that this, again, this ApoE4 may not be the most important risk to be thinking about. So how can we improve these things for the brain? So one is our diet, our nutrition, eating a rainbow of colors every day, because these colors represent antioxidants. And so if you go back to death by oxygen, we're generating these reactive oxygen species. And how do we combat this? We combat this with the foods that we eat. So we have all these beautiful colors in our foods, and these are all antioxidant compounds. There are supplements that we can use to also boost our antioxidant capacity, including vitamin C, melatonin, and glutathione, which are two of our natural antioxidants, many spices, healthy fats like in fish oil. So there's a lot of modifiable things we can do in our diet to protect our brain. Another thing that you might have heard of is eating fewer calories. And this can be done by just restricting caloric intake every day. It can also be done by cutting the amount of hours per day that we're eating, so only eating in a narrow window of time. So particularly eating late in the evening is thought to be worse for our general metabolism. So there are people that are maybe limiting their eating window to anywhere from 4 to 10 to 12 hours of the day, rather than eating more around the clock. So it's suggested that at least a 10-hour window for eating is best, but even less may even be better. And what about exercise? Well, it has turned out that our muscle is actually an endocrine organ. So what is endocrine? Endocrine means there are hormones being secreted that impact our whole body. So when you exercise, you're actually releasing all of these compounds over here that have been labeled myokines, meaning that the muscle is stimulating them. And these have effects on our brain. So here is results of a study that was in neuropharmacology back in 2021, showing this pre and post benefit of exercise. This is after 8 weeks of exercise, and the benefits that are included are our glucose metabolism. And remember, this is important for the brain. Levels of ketone bodies. There's been suggestions of ketogenic types of diet for the brain. And so this is just that glucose metabolism in the brain, again, that's been improved by exercise. And there's no really minimal threshold, like how much should I exercise? It's thought that around 10,000 steps, or in this study, it was 9,800 steps per day. But if you can get any number of steps in per day, that's better than none, right? So what about this blood supply to the brain? We saw that study where there was not enough glucose in the brain. How does glucose get into the brain? It gets into the brain through our blood vessels. So this blood supply to the brain, and this is pictures, this is imaging. So these bright colors in the young people, the yellow, the red, the green, this is all showing activity in the brain. And then we get older and our brain activity slows. Well, here's mild cognitive impairment, and here's the different levels of Alzheimer's disease. So this is a very strong relationship between circulation in the brain and our brain function. And one thing that's important for our blood vessels is a compound called nitric oxide. The drug Viagra, which is a drug for erectile dysfunction in men and has been used somewhat in women, may actually reduce Alzheimer's risk because it helps to increase nitric oxide, which improves the perfusion of blood even into the brain. So how do you get more nitric oxide? You can get it in your diet. So particularly beets. I don't know if you've heard of there's a big craze about using beet juice and beet powders, but you can just eat beets. Because when you eat beets, the nitrate in the beet in your mouth gets converted to nitrite, and that nitrite gets converted to nitric oxide. So again, here's this nitric oxide bioavailability across that, people who are young, old, with cognitive impairment and with Alzheimer's disease. So there's some opportunity perhaps for Viagra to be some type of preventive drug, but in the meantime, you can eat your beets. Also, hibiscus tea is another good form of compounds that can be converted into nitric oxide. So this is a recent study that some colleagues who were naturopathic doctors did, where they took people with cognitive decline, they looked at their nutrient intake, and they developed individualized treatments using supplements, diet, how much water they're drinking, also coaching sessions, having people increase their social activities. And so there were 25 people, and they actually showed of a 6-month intervention that there was a significant association with improvement in memory. So this bodes well for future research and intervention into how do we slow this decline in memory change in older people. So one of the important things to address is sleep, and I can't say strongly enough how important this is. So women are more commonly plagued with sleep problems than men. Many of you may already know this if you live with a male partner or a female partner, that men can drop off and stay asleep much better than women. Women's hormonal cycles over the lifespan affect our ability to sleep. And we know that the endocannabinoid system modulates our sleep function. So this circadian dysfunction is affecting around 20% of the adult population, but again, more commonly women. So this can be insufficient, poor quality sleep, difficulty getting into sleep that's cutting into your sleep time, and difficulty staying asleep. So I think I already said these things. And one thing that I didn't say is that this problem with sleep can also be related to a decline in our brain's melatonin production as we age. So that's an important sleep compound. So this was a study that was reported a few years ago that was actually looking at what's the best time of day to take our drugs. That was one thing the study was looking at. But what came out of this was also circadian disruption and disease across the lifespan. So even young people and lack of sleep, teenagers, young adults, and then as you get up into middle and older age, you can see all of these things that are associated with circadian dysfunction across the lifespan. So we have neurological disease, propensity to have more septic shock, delirium, osteoarthritis, rheumatoid arthritis, arrhythmia, and Alzheimer's disease. Well, why is this? So here's this melatonin level that I was telling you about. Here's 65 to 70 years of age. Here it's dropping at 70 to 75, and then you get older 75, and the melatonin levels even lower. And I want you to notice that there is this peak time for melatonin that typically occurs around 3 a.m. So sometimes taking melatonin at bedtime is not enough to sustain people through this 3 a.m. time that melatonin should be peaking, which is a common time that people may be waking. So there are sustained melatonin forms, sustained release that may actually help get through this 3 a.m. peak for melatonin. So at night, we have what's called an ultradian rhythm, where you first go into some REM sleep, and then you drop down into what we ultimately call restorative sleep. So you can see that first restorative sleep cycle is the longest, it gets shorter, and then each cycle after that, we're not going into as much deep sleep anymore. So it's really important to get this restorative sleep, and why is that? We know that during this sleep period, when we're in deep restorative sleep, all of our brain waves are in a synchronized pattern, and this has now been associated with a pumping action in the brain that's actually flushing out our waste products of the brain from the day. So if deep restorative sleep is not happening, the brain is not getting its housekeeping done. And THC, specifically, the compound in cannabis we talked about, has been shown to potentially strengthen this ultradian rhythm. This is before the patient was given the THC at bedtime, and this is at 10 milligrams of that same drug, dronabinol, we talked about, and it had this suggestion of strengthening that ultradian rhythm. So this is a common report I get from patients, that they sleep much more soundly and feel more rested using THC at bedtime. This is just more about removing metabolic waste in the brain, and this is associated with our lymph system. So it was discovered that the brain has its own lymph system. So we want the brain to be cleaning out every single night, and this hopefully is something that people are starting to really pay attention to when they're much younger, before even getting to that point of having mild cognitive impairment. We did a brief study of this at the geriatric clinic here at UCSD and just asked older adults about their cannabis use. And we found that 30% of the people who said they were using cannabis or had used it were using it for sleep disturbance. Not surprisingly, more were female, because females have more sleep problem, and that they were using products containing THC. So what are the things that you can do for sleep? If you haven't had a sleep assessment, maybe getting a sleep assessment from a sleep doctor, paying real attention to sleep hygiene, using melatonin and perhaps cannabis. Sometimes I'm even using those two together if people have very severe sleep problems. Another supplement that I will use is called lithium orotate, which is a mineral supplement of lithium, not the same drug used to treat bipolar disorder. And then a form of magnesium that gets into the brain really easily to help calm the brain and also facilitate sleep. All right, we're going to talk briefly about our ability to relax or anxiety, because this is something that you probably know, that older people with cognitive change, often anxiety can be one of the first symptoms of this. And again, the endocannabinoid system is modulating our adrenal function and how we respond to stress. So paradoxically, often people may report that cannabis causes anxiety, but interestingly, anxiety is one of the #1 motivations that people may be using cannabis for. And this is a bunch of different surveys. This is the number of people in each survey. And this is the percent of the people that said that they got anxiety benefit from using cannabis. There may be what we call biphasic effects of that, and we'll talk more about that. Further, in our survey, and again, these other surveys, we asked people, were you using cannabis to substitute for anxiety drugs? And here is that line in the results. We had this number of people saying yes, they did use cannabis to substitute for anxiety medications, also antidepressants, and the #1 thing they used cannabis to substitute for was opioids or other pain medications. But in these other surveys, they also found people saying that they were substituting cannabis for other things. So cannabis, before I move on to this section, cannabis can be used to help with anxiety, but the dosing can be sometimes a little tricky. And in older people specifically, who are much more sensitive to the effects of cannabis, the usual doses that people are using for recreational purposes are not appropriate, especially for trying to treat anxiety. All right, so briefly, I wanted to talk about our immune system. This role of the endocannabinoid system in immunity is pretty important. We know that it's a gatekeeper, in fact, for the immune system. Well, why is this important for brain health? Because we know that in the context of cognitive change, there is inflammation in the brain. So these receptors for the endocannabinoid system are on all of our white blood cells, which are our lymphocytes, different kinds of immune cells, all of which can get into the brain. And the endocannabinoid system is there to help resolve inflammation. So we can get inflammation pretty easily, but resolving it can be more tricky. And this cannabinoid 2 receptor is on these cells in the brain that we call microglia. And so this is another role where cannabis can help turn down the volume on inflammation in the brain and help protect our brain. In fact, our federal government has a patent for cannabis as neuroprotectants. And we're going to talk about that in this section called Forget, where, again, women are often having more incidents of dementia than men. Our endocannabinoid system is regulating our brain plasticity, our memory, our neurotransmitters, and our pain, our perception of pain. So we know that these rates of dementia are going up. Most of this is in women. This is my grandmother and my mother and me when I was a bit younger. And luckily, I think I have some pretty good genetics for my cognitive health, it's looking like so far. But I'm doing all of these things to protect my brain as well. Our endocannabinoid system varies across the lifespan. So this is one of the enzymes making our endocannabinoid compounds. And you can see that over the lifespan, as we get older, that function declines just like everything else, which is why we may be more sensitive to cannabis as we're older. And here's that report that our federal government has a patent calling cannabidiol or CBD and THC neuroprotective and antioxidant. So here's a study showing that our natural endocannabinoid called AEA blocked the amyloid beta accumulation in cells. So that's just kind of a positive thing to know that our endocannabinoid system and THC may be effective for helping clear out the brain. We also know that THC inhibits the breakdown of acetylcholine, and that's our prime neurotransmitter that gives us good cognitive function. So these are some reasons that cannabis might be helpful in older age. Here's a study of medical cannabis looking at older adults and their activities of daily living. These were average age of 79. We had 45% of these users were using cannabis 3 times per day. Some of them quit using their opioids. Some of them quit using benzodiazepine drugs. They were using it for different reasons like pain, Parkinson's disease, dementia, only 2 people in this study. But you can see that the depression scale measures improved and pain improved, and there was sort of a not significant effect on daily living activities. So it wasn't making people too sedated or too dysfunctional to use cannabis and continue their daily activities. So these findings about cannabis and Alzheimer's and dementia suggest that extremely low doses of THC that may not even make people feel high or have a negative effect could be something that might be reasonable to consider to slow our cognitive decline as we age. And so here are some of the other things in people with dementia that cannabis may be helping: agitation, anxiety, aggression, wandering, lack of appetite, depression, insomnia, restlessness, and excessive vocalizations. Because cannabis can have a bit of a sedating effect. So you kind of have to balance the dose where you're not too sedated, but maybe just calmed down. Here was a trial where they gave only 1.5 milligrams 3 times a day of THC, and they didn't really find any benefit at this dose in this patient cohort. So there were 24 getting the THC, 26 that got a placebo treatment, but there weren't any negative effects on their quality of life or activities of daily living, and it was safe and well tolerated. So maybe this is just not the right dose. Maybe 1.5 milligrams of THC is not quite enough. So here's a report from caregivers where 79% reported that THC was effective in improving neuropsychiatric symptoms. And so here is that report. Antipsychotic use, look at that, 45% of the people in this study quit using antipsychotics. Many of them also were able to decrease the dose of their antipsychotic. So sometimes adding cannabis on is not contraindicated and may provide the ability to remove some other drugs. All right, there's also these compounds that we call neurotrophins, or stimulating our cognitive faculties, and the compounds known as nootropics. So there's one I use commonly, CDP choline. We have to get choline in our diet to make acetylcholine. So this can be a real problem in older people who are not getting enough protein because we don't make this compound and we need it to make our acetylcholine. And you mostly get choline in the diet from meat. So especially if older people are not getting enough protein or eating enough meat, may not even be getting enough choline to make their acetylcholine. And then here's just one example of one of these nootropics. It's called huperzine A. It's also been shown to inhibit the breakdown of acetylcholine, so we have more acetylcholine in the brain. It may enhance other signaling or be helpful in vascular dementia. So these are some more things that are being looked at. So there's a lot of different forms for using the cannabis. I think we're running out of time and I want to get to your questions. Just one thing I wanted to highlight is that CBD is not an analgesic. So using the whole plant of cannabis containing THC is often important when using cannabis. There's different effects, whether it's inhaled or taken orally. There's differences in the time course. Inhaled is a very rapid effect, whereas oral is much more slow. This is a drug form of cannabis, not available yet in the United States, but you can see this peak in the bloodstream not happening until 2 hours after taking it. This is one reason older people sometimes get in trouble with taking an oral cannabis product. They don't feel anything and may take a second dose and end up with having too much in their system. These are forms of being able to inhale cannabis without burning it. These are vaporizers, dry vapes, which are different from vape pens, which I say, just say no to those. They're too potent, especially for older people. There may be side effects. These are dose related. They're more pronounced with inhalation, and they can be avoided by using what we call a dose titration, also using low potency cannabis. So here we surveyed older, middle, and young people, and we asked about, look at these cognitive effects. Older people were much less likely to report that they had difficulty concentrating, difficulty finding words, being more forgetful, having more short-term memory problems. Why? Maybe older people are already having these problems. Or maybe it was also because older people were more likely to be looking for less potent cannabis to be using. So I just found this, wanted to throw it in there. Is cannabis use actually contributing to cognitive decline? This just came out in current Alzheimer's research. It's a brand new study. It is looking at past records rather than looking at a prospective trial. But they found that even non-medical cannabis use was associated with reduced odds of subjective cognitive decline. So this is asking people about their cognitive function. But compared to non-users, they felt that they had less cognitive decline than people who did not use cannabis. So this is a very patient-specific, use of cannabis for different reasons to help with sleep, maybe being prime in this patient population, but also having the potential to help with agitation and anxiety, and having a more beneficial effect than sometimes than some of the antipsychotics that are being used. So here we have this long line of people lining up for cannabis over pills and surgery. And I see this evidenced in my practice by how many people want to come for a cannabis consult to talk about how to use cannabis for health benefit. Excuse me. So thank you for your time, and I'm going to end this slideshow now.